Hello dear patients, today we are going to talk about the case of white acne on penis. A man came to us and according to him white acne developed. For this particular case, it's characteristic that they didn't bother him almost at all. There was no itch and no burning. There was no reddening around these white acne. He even tried to press on them, but eventually he discontinued this action. He got scared and came to a doctor. So here we see little vesicles on quite an unchanged skin of usual color. In this case it's necessary to take analysis, most importantly from the surface of these elements. We even had video showing that they can be pierced by sterile needle, and then the content of vesicles is taken for sexually transmitted infections, including different types of herpes. Also, scraping is taken from inside the canal, from glans penis. In this particular patient, the glans penis was clear and there were no discharges from urethra. Second type of herpes was found in PCR analysis. We took blood test for herpes and he had no antibodies and no virus itself in PCR analysis of blood. Indeed, this man had a sexual contact about 10-12 days ago, and this is a primary rash of herpes on sexual organs. In these cases, in cases of initial appearance of rashes, there is an opportunity for complete healing. My teachers were proponents of the idea that lymphatic system of body holds the viruses when they get into the body. In my practice, I had cases when active treatment of primary appearance of herpes in early stages led to the fact that later on no antibodies appeared, and there was no herpes itself in the blood, and there were no repetitive relapses for several years. I have such patients coming for control examination. It's important to do the earliest start of treatment. These are antiherpetic medications such as valacyclovir, famvir, and even a usual acyclovir. These are medications of immune range, after the analysis for immunogram is taken. These are medications by type of ozone, by type of vitamin therapy. In parallel, the patient is prescribed not to have any sexual contacts. It's better not to have contacts even with a condom on, because it doesn't always prevent herpes. The same way as miramistine, on which a lot of people place hopes on. Also, it's very important for these patients, after the treatment is done and after clinical manifestations disappear, to do vaccination using medications by type of antiherpetic vaccine. An example of this is Vita-Herpevac, which was done for the patient. This increases the chances of immune response development for herpes. In our case, the herpes of second type, as well as complete healing or sustainable remission for a long period of time. In this patient, after the treatment was done, control analyses were done. Both blood analysis and PCR analysis from the surface were negative. And after that, vaccination by Vita-Herpevac was done. If it is necessary to diagnose and treat any rashes in the area of sexual organs, you can consult the neurologists and urologists of our paid medical center of Dermatov Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.